Hello, and welcome all viewers to this Society of Breast Imaging webinar, introducing our keynote speaker for the upcoming symposium. Dr. Jame Abraham is the chairman of Department of Hematology and Medical Oncology at Cleveland Clinic and professor of medicine at Cleveland Clinic Lerner College of Medicine. Last year, he served as the interim chair for the Taussig Cancer Center and is the deputy director of Case Comprehensive Cancer Center. Dr. Abraham was previously the director of Cleveland Clinic Breast Oncology Program and co-director of the Cleveland Clinic Comprehensive Breast Cancer Program for several years. He has more than 20 years of expertise treating complicated breast cancer diagnosis from early stage to metastatic and leading novel clinical trials. Dr. Abraham is a member of the National Comprehensive Cancer Network Breast Cancer Committee, which sets treatment guidelines for breast cancer management across United States. He's the vice chair of the Research Strategy Committee of NRG Oncology, one of the largest cancer research groups in the world, funded by the National Cancer Institute, NCI. Dr. Abraham also is a member of the Breast Committee Workgroup for NRG Oncology. He is the vice chair of Research Review Committee for the National Surgical Adjuvant Breast and Bowel Project, commonly known as NSAPP, and is a member of the Scientific Advisory Board for the same. Dr. Abraham completed his residency at the University of Connecticut School of Medicine, followed by fellowship in medical oncology at National Cancer Institute, and then a hematology fellowship at the National Heart, Lung, and Blood Institute of NIH. Dr. Abraham is from India and earned his medical degree at the Calicut Medical College in Kerala, India. He edited the first edition of Bethesda Handbook of Oncology, which is now in its sixth edition, one of the best-selling oncology textbooks in the world, and considered the standard textbook by many universities and hospitals. Dr. Abraham is also the deputy editor of Journal of Oncology Practice of ASCO and associate editor for the ASCO Post. In addition to all of this, he has received numerous awards for patient care and teaching. He has been involved with multiple national clinical trials, many of which are NSAPP trials, to find better treatment options for early stage metastatic, triple negative, and HER2 positive breast cancer patients. He's the North American study chairman of Destiny 05, which is a global adjuvant breast cancer clinical trial enrolling patients from more than 30 countries. He has contributed more than 200 papers in major journals and national and international presentations. Despite all this, his primary focus remains passionate care of patients with breast cancer. His patients, if you ask me, absolutely love him for his kindness, personability, compassion, knowledge, diligence, and the extra steps he goes way and beyond in treating each and every one of his patients. He's truly a treasure for them. And to top it all, Dr. Abraham is our keynote speaker at SBI Breast Symposium 2023 at National Harbor on May 5th, Friday, where he will speak on the topic of insights on the in situs, discussing incidence, management, clinical trials, and future treatment options for DCIS and PLCIS. Today's SBI chat aims at introducing this tremendous physician to our breast community, who I have personally had the pleasure of knowing and working with as an amazing colleague while I trained and subsequently worked at Cleveland Clinic. Welcome, Dr. Abraham, to this Society of Breast Imaging webinar.
Thank you, Dr. Sharma. It's so kind of you. Truly a pleasure.
It's our pleasure to host you today. We'll go ahead and get started with this chat. So, Dr. Abraham, you've had this long, successful academic career. How did you initially land in the field of breast oncology?
Again, thank you for the opportunity, and it's truly an honor for me to be part of this amazing symposium. And as I always say, I really admire our radiologists and our breast radiologists, especially because you give us the first idea, that diagnosis that the patient, the woman, has we need to something worry about cancer. Again, I really admire and appreciate your service. So coming back to my story, again, as Dr. Sharma, you mentioned, I'm from India. And when I was in second year of my med school, my mother's sister was actually diagnosed with cancer. She was 42. She has young kids. And of course, my cousins, we were really close. And back then, oncology care was, as you can imagine, not that mature in many parts of the world, including India. So I was really involved in her care. So that gave me a perspective from the other side, from the other side of the bed, what it means to be a patient's family, or view the world from the patient's perspective or patient's family perspective. That's the time I decided I'm going to take oncology as my career. That really led to my whole journey, and eventually, and of course, at Connecticut, and then at the National Cancer Institute. So, as I always say, this is not a job for me. It's a passion, and we continue to work on improving the lives of patients with this diagnosis.
And what an amazing journey it's been. You work at one of the top hospital systems in the country and are leading a large cancer center department. So, what have been some particularly challenging aspects of your career?
So, thank you for that question. As you said, I've been doing breast cancer treatment, leading breast cancer team for 15 years or so. Then in the past 3-4 years, I transitioned into this department chair. And that was August 2019. And you know what happened 3 months after that, 3 or 4 months after that, the whole world shut down and the COVID happened. So again, it's fascinating, and it actually made me much more humble, and really admire our profession. And if you look at globally, and of course, what we do as cancer doctors on a daily basis. And as you know really well, when the world shut down, when the COVID happened, cancer didn't stop. We need to continue to give care for our patients, because our patients with the diagnosis of leukemia or metastatic breast cancer, lung cancer, they are worried about their life. So our challenge at that time, as soon as almost a few months after I took over as the department chair, was how to continue to, again, 2 or 3 things. One, how do I continue to support our team? Because there's a lot of unknown. Are we going to get sick? And how do we continue to take care of our patients? And then how do we continue to make sure that our patients don't get sick from this unknown virus? So that was my biggest challenge. But as you know, Cleveland Clinic is an amazing place. Like any other organization, we rallied around, and we supported our team, our patients, and we were able to continue to provide care. But moving forward, we have and I always really say that our people make the place the best. It's all about the people, all about our colleagues. We have a truly, truly amazing group of people who are passionate about providing cancer care. So it's a privilege for me to work with this amazing team.
Absolutely. And you do such a great job in leading such a large department nationally and internationally. You're also the chairperson of the North American NACPB60 trial, which is a global adjuvant breast cancer clinical trial enrolling patients from 30 countries. And you're leading and doing all these important roles, wearing so many hats. What keeps you motivated to continue to be involved in breast oncology research?
So it goes back to my story about my original journey. Cancer, and I always, people ask me, why do you do cancer? Why can't you do something else? And then I tell my students and my residents, cancer is real. It's real. You can wish this away, but it's real. And we want really good doctors to take care of patients with this real diagnosis. So you can't ignore this, but it's not going to disappear. So my original story, I want to make a difference in the patient's life, and that's why I really got into oncology. And the most, one of the most important way we can make an impact is research. Clinical trial or research is the way we can make an impact for the future. So throughout my journey, again, in a very small way, and I don't want to say anything more about what I do, but in a very tiny way, I was fortunate to be part of many large clinical trials. NSABP, I was privileged to work with NSABP for 20 years or so. As you know, an amazing group which really made and it did landmark studies in breast cancer, changed breast cancer treatment globally. And I was, now I'm really honored to lead one of these trials which can potentially change practice in adjuvant setting. So if you ask me what drives me, it's my continued belief that we can make things better for tomorrow for our patients.
That is such an excellent goal to achieve. Thank you for doing all the hard work you put in. In 2010, you received an award from the President of India for your outstanding contributions to the field of breast cancer care internationally. Please share some high points of your career like this one in the last several years that make all the hard work feel worthwhile.
Thank you, Dr. Sharma. Again, I'll say, I'm just lucky and fortunate to be there in Rashtrapati Bhavan, and I was sitting next to Amitabh Bachchan. I'm sure you know who's Amitabh Bachchan and Shashi Tharoor. Again, they are really eminent personalities in India or globally, and there I'm sitting, So, but anyway, as you said, it's I'm just lucky and privileged in my journey, and I'm trying to make an impact in my small way in the journey of a patient with cancer. Again, I really truly appreciate the recognition from the government of India, President of India.
Very nice. Give us some advice on what can early and mid-career physicians, do to get more involved in their respective national societies.
So let me say this. I always say your mentor or whom do you know? That's really important. Really important. So I'm truly privileged to work with some amazing doctors throughout my journey. They really lifted me up. So I have to, I'll give all my credit to the people who lifted me up. So I'll say the young doctors who are starting their journey, the most important thing is try to select the right mentor. It doesn't have to be in your own institution. And let's just say if you're working in a unique place or a smaller place, you don't have someone there. These kind of societies, like SBI and some of the societies will allow you to network and then connect with people who aligns with your passion, and then work with them. And you can have probably one or two mentors or three mentors. You don't have to have just one mentor. And make sure it's your right mentor. It doesn't matter. Forget about the title. Forget about where they are from. You have to have that connection with the mentor. And I'm kind of saying from my own experience, you have to have that right connection. So your mentor is really important. And then, of course, Dr. Sharma, as you know, we all work hard, and volunteer, put your name out there, and you're always willing to go that extra mile. And as you know, societies like SBI or radiological society, everybody is looking for people who are willing to work hard and contribute. And if I can say, now I'm a little on the other side, we are looking for younger people who are willing to work hard and are willing to contribute. And we are always looking for the next leaders, who's going to carry the mantle. So it's a tremendous opportunity for young people to connect with mentors, connect with network, and work with organizations, and people are always willing to help. That's my feeling.
Thank you so much for those excellent tips. I'm sure a lot of our audiences will benefit from these. In fact, the SBI has recently started a mentorship program, which is in its pilot phase right now, where we are trying to connect the younger members and trainees in fellowship to earlier, late career staff for potential mentorship connections, so they can find out mentors at other programs or practices and not just their local practice. So thank you for sharing that. I encourage everyone to get more involved and apply for our mentorship program. Of everything you do, Dr. Abraham, your outstanding patient care stands out as your exceptional trait. I still remember patients literally saying praises and praises for you. It's evident in all your online feedback from your patients. Uh, in person, for them, you're a superstar, you're a god. You have treated them. I specifically remember cases of few young patients in their 20s who you treated even from like stage 4 metastatic cancer, and they still come and give you hugs every year when they meet you at annual appointments. In your recent TEDx talk that you did, you talk about building trust. Can you share some pointers that have helped you build this trust worthy, strong connection, both with your peers and patients?
Thank you, Dr. Sharma. Thank you for the kind words. We are so privileged. We are so privileged to walk into somebody's life when they are at their worst moment, right? People like you, Dr. Sharma, you just called them and said, or you just met them and said you have a diagnosis of cancer. And the next thing is they're coming to someone like me, and I'm walking into their life, and they allow me to walk into their life. So it's a huge responsibility. I take it as a responsibility. I always tell my residents and fellows and other people, it's not another stage 2 ER positive breast cancer. It is someone's mother or daughter, or someone's sister sitting there scared of their life. So always treat an individual, a person like a person who's scared, and who's scared for their life. And so we have a huge responsibility of building that trust. And the whole thing depends upon that. And if I don't, and I don't understand who that person is, a mother, a teacher who has an ailing mother, who is, she's worried more about her mother, and then probably somebody in high school who's struggling. So you need to really know who that person by listening to their stories and making that connection. I always say you need to listen to the stories, make that connection. What makes them worry or happy? Then only you can really have that connection, and then start talking about treatment. So building trust is the foundation of what we do on a daily basis.
Excellent. Um, and those stories of your trust and connection with patients is, I think, a prime example we can all learn from on building that trust initially when we first meet the patient, even at the time of biopsy or discussing the mammogram results with them within the breast imaging community. It's so important, because then distinctly you will remember the patient, and the patient remembers you when they come see you the next year. um, can you share with us some tips on building oneself to be a future successful leader, and also in creating a healthy and rewarding work life balance?
Um, so for future successful leader, again, I don't know if I'm the right person to say. So I'll say a few things. One, everything what we do, as clinicians, whatever we do in our sphere, radiologists, surgeons, let's just say technologists, we make a huge impact in this healthcare space. We make a huge impact. So find the niche or the passion which inspires you every day. Really find that passion. Again, if I can say, I was really privileged to find my passion. I know it's a cliche to say, but I don't feel like I'm working every day. I'm kind of really living my passion every day. So find your passion, find your niche, and then really try to be good at that. And again, of course, I've been doing this for a long time, so I passed that 10,000 rule. I've been doing this for a million times. So when I walk into a patient's room and talk about any complicated scenario, even patient asks, "Have you seen this before?" I said, "Absolutely." So be good at it. By keep doing it, you are going to be really good at that. But at the same time, don't lose that individual touch, which we were talking before. And I always say, for us, it's another patient with stage 1 breast cancer. For her, this is the first time it's happening in her life and in her family. So make sure you don't miss that individual touch. Don't become mechanic. So find your passion, work hard on becoming really good at it, and continue to make sure that you are providing that individual care from a patient perspective. And then again, depends on what else you want to do, be an educator or researcher or administrator. And for me, my career kind of grew into the administration. And um, I'll say, and if I can say, again, I'm not trying to talk about me, I know how to bring people together. So I think as a leader, your strength is going to be, how do you bring people together? How do you get them excited about something which is going to make things better for tomorrow? It's not about you. Always remember that leadership is not about you. It's about the team. How do you bring them together, make them excited, and then and make sure that they all listen to them, make sure they all understand where you're planning to take. And if it's about you, it's not going to work. And that's not a genuine leadership style. You need to really care for the people whom you're working with.
Exactly. And like you discussed before, building that trust with your peers and your team, um, who you're leading, is crucial. Um, what is one advice you would give if you had to go back in time to your early career self?
That's a tough question. I know you asked me about work-life balance. I don't know if I'm really good in work-life balance. Um, so, and if I can say, I'm an immigrant who came here. As any immigrants, we are driven to prove. Probably I should slow down a little bit. Finding a right balance. That's something which I continue to work on. So probably that's something I need to learn.
Okay. Uh, can you give us like a little sneak peek into your upcoming talk at the symposium, so our audiences can get excited and all be there to hear you in person?
So DCIS is it's an enigma, right? We talk about is that cancer? Is that not cancer? And then we talk about how do we are we treating or are we over treating? Are we over diagnosing? So it's a really good topic. how do we find a correct balance for making the right diagnosis from a radiological perspective to the pathology. How do we find the right management? And as you know, Dr. Sharma, we have patients with the diagnosis of DCIS sometimes going for extreme measures. Oh, I'm going to do bilateral mastectomy. So how do we continue to educate that patients in that shared decision-making process? And then, of course, what's next? What other things we can do for treatment, prevention, and what's for the future of DCIS management. That's what I'll talk about.
Excellent. Well, thank you so much for your time and amazing advice, Dr. Abraham. It is truly an honor for our community to get to know you better. And we are all so excited for your upcoming keynote lecture at the symposium. We will see you soon in person at National Harbor, Maryland, at the most exciting meeting of the year, SBI 2023. Thank you.
Thank you, Dr. Sharma. Really, really appreciate it.
You're welcome.